Good afternoon, Dr. Mac.
Hey, how you doing?
Good. How are you doing?
Doing good. Long week.
Oh, it has been a long, wet week.
Long week.
All
Long week.
stuff over the past couple of days and stuff going on and all that good stuff. So, yeah, it's always good to be able to exhale on a Friday going into the weekend.
Definitely. Definitely.
Yeah. I love the combination today.
Thank you.
Is
Thank
that
you.
new? Is that brand new?
No, I just had it. I had it for a little while.
Oh, okay, well, that's the story, and you sticking to it.
That's the story. I'm sticking to it.
Well, all right, we'll take that then. That's
Yeah.
fine. It always looks good, Dr. Mac. Very good.
Thank you.
Yeah, but so of course, ladies and gentlemen, once again, it is Dr. Winston McIver Jr. and yours truly, April Garner, with the Network Live. Thank you so much for tuning in today. We really do appreciate you hanging out with us on a Friday afternoon. And we're here with our week 34 COVID-19 updates, week 34. Yes. And of course, Dr. Mac has a lot of good information to share with us. So I just want you all to, if you're like me, I always have a notepad because I try to jot things down as he goes along, just to look at the numbers and take it all in. Sometimes you have to unpack it later to really get the gist of what he is communicating to us. And it's the same message that it has been for the past 30 some weeks, that basically COVID is alive. It is unfortunately brewing and surging, and we're going to learn a lot about that today. And so Dr. Mac, you want to go ahead and get us started with your doing the things the way you do it.
Right. We'll start with the graphs first, because pretty much I've tried to condense everything into trying to find graphs that would kind of be more visual and that kind of thing. So we'll start off with the graphs. First thing we was just, like April said, thank you all for joining us. We try to give you as concise information as possible from reliable sources and that kind of thing. So first, we'll start off with just kind of looking at the world global outlook on COVID right now. Total reported cases worldwide are almost 53 million. Deaths are over 1.2 million. The last 14 days, the number of cases worldwide have gone up 23%, and the number of deaths have gone up 38% in the last 2 weeks. Now, I'm a visual person, as a lot of people are, and I like to show these graphs to kind of show you exactly what's going on. So as we see, the numbers are not just going up, but they're taking off and going up, particularly since October. Since the 1st of October, when we started seeing this next spike in cases, but this is worldwide. So just be aware that not only in the United States are we having issues, but worldwide there are issues of resurgence of COVID-19 as well. Next slide. The next slide really looks at the United States. And again, the number of cases are over 10.5 million. The number of deaths are over 240,000 deaths. In the last 14 days, the number of cases have gone up 72%, and the number of deaths in the last 14 days have gone up 33%. But the most concerning thing on here is the number of hospitalizations. That's gone up 39% in the last 14 days. That's very concerning, because one of the questions is, there is a little bit more testing that's being done now, still not as much as we need to have done. However, when you see numbers like this, particularly hospitalizations going up, it tells you that the disease is the cause, and it's not just because we're doing more testing, that it is getting worse. The hospitalizations are a direct correlation with disease activity in the communities. We've got over half the states that are reporting record numbers of hospitalizations, and some states are even running out of hospital beds and having to send patients to neighboring states. So this is very, very concerning on what's happened here. And again, we haven't even gotten into winter yet. So, and I just wanted to make aware of that 72% increase in cases in 14 days. And as you look at the graph, you kind of see the tail end of that graph to the far right, where it's just kind of swooping up. It's going up. And again, still, that's with out the appropriate number of tests that needs to be done. I think last week when April and I were on and I showed a graph, it looked like a periodic table. It mentioned that there were 29 states that were still under testing what they should be doing compared to the number of people that they have, percent positivity, and the population of that state. There were 29 states that were still under testing in the United States. Okay, next slide. Next slide looks at hospitalizations. As I kind of following up on what I was just saying, the numbers are going up, and they're higher now than they've ever been. So at no time during COVID has there been this many people hospitalized. We're talking about upwards of 70,000 people that have been that are hospitalized due to COVID. So again, very concerning. COVID is alive. COVID is here, and we need to take heed to that. But this is a very staggering chart here that physicians did not want to see happen, particularly before we even get into winter. Next slide. Next slide looks at the positive cases. As we see here, the numbers are going up tremendously. Today will be the 11th straight day of over 100,000 positive cases. The 11th straight day of over 100,000 positive cases. On a more sad note, Wednesday, we've had the most deaths in a single day going back to early May. There were 1,839 deaths on Wednesday. That's the equivalent of 15 737 aircrafts crashing. 15. Almost 1,900 deaths again on Wednesday. Confirmed deaths from COVID. Very, very concerning. Because as the hospitalizations go up, the number of deaths are likely to follow. Even though, treatment protocols have gotten better, in the hospital. It's still no cure, but treatment protocols have gotten better. Whenever you see that many people hospitalized, you know that there's going to be a percentage of those people that unfortunately are going to pass away. Next slide. This is a concerning slide also. Now, this is from the Institute of Health and Metrics and Evaluation with the University of Washington. They do a great job of looking at epidemiology, origin and distribution of diseases, and biostatistics, the number of cases that go along with those diseases. And they've come up with these projections, and their projections have been spot on from day one. Some of the numbers that we saw early on, I just couldn't believe as a physician that this would happen, but they are happening, and they've been spot on. So what they reported this week was that by February the 1st, at the current rate that we're going, by February 1st, 2021, there'll be over 399,000 deaths. Unbelievable. 399,000 deaths projected at the rate we're going by February the 1st. If there was universal mass precaution, it would be 337,000. But with states easing up, if states ease up the mandates and not require testing, by February 1st, there could be over 513,000 deaths. Now, this is staggering. And when I saw these numbers back in May, I couldn't believe the numbers. I said, it's got to be something off. It's got to be a factor of something that's off. But they have been spot on almost since day one. And out of all the slides I'm going to show you today, all the slides we're going to discuss today, this is by far the most concerning one. For a couple reasons. For one, just the sheer numbers, but for two, they've been spot on. And so again, we're talking about possibly close to 500,000 people by February 1st. So again, it's very important to understand the nature of what's going on. Very important to understand that, even though we may have COVID fatigue, we may not want to hear about COVID. We may be tired of hearing about COVID. This is not to be played with, and it's real. And I'm concerned because I think just a number of number of people just, I don't know, just don't take it seriously enough. I hope that with some of the changes that have just taken place in the last week, things will be more on track with national protocols and national advisements and national national information being disseminated about what this is. But again, this is the same thing and similar that we've been talking about for the previous 32 weeks. But again, these projections are very worrisome. Okay. Next slide. Next slide looks at South Carolina specifically. Right now, there's a little over 190,000 cases. There's a little over 4,000 deaths. The cases in South Carolina have gone up 25%. The number of deaths have gone down 31%, which is great news. And the number of hospitalizations have gone up 1%. Again, I love the fact that we're seeing the death rate drop down. That's good. That means a lot of times that people are getting to the hospital sooner. They're being treated sooner. The protocols are better. And so that's good. But whenever the cases go up, typically the hospitalizations will do such, and typically the deaths will do such. But hopefully the trend in South Carolina can continue as far as the deaths go to keep those numbers down. So I just want to see that. If you look at the graph, you can see we did have a big bump in July and August, kind of went down, but that line is kind of trending upward as far as the cases go. So just to be aware that in South Carolina, even though they maybe talk about the death rate going down, the cases are going up, and that's still with under testing. Okay, next slide. Next slide is kind of a compilation from DHEC as of today, where we have new confirmed cases, 1,300, total confirmed cases, right around a little over 181, probable cases, 100, total probable cases, 10,000. So again, there's some of these people that will confirm cases, and then there's some of them where there was still some question as to whether or not, but they fell into the probable category, which means that they more likely than not had it. And new confirmed deaths, 17. Going all the way down, I want to look at the part on the right where it says percent positivity. It's 14.7%. Again, the percent positivity should be definitely less than 5%, ideally less than 3%. So we're at 14% positivity, almost 15% positivity, which indicates that there are more cases likely in South Carolina, but there's not as much testing to be done to catch all those cases. Whenever the positivity rate is high, it means that area should be doing more testing. Okay, next slide. Next slide still talks about South Carolina. As we see, the specimen, the daily testing done is going up, but we're still not where we need to be. But I'm happy to see that that curve is going up on the graph to the left. On the graph to the right, just kind of talks a little bit more about the hospitalization. As we see around August, we were kind of at our peak for hospitalization. It did go down. It did dip down early October, but it is starting to kind of tail ever so slightly back up. Okay, good. Okay, next slide. So I want to spend a little time talking about this because this is something that I've been researching, having an interest in mental health. And there have been some studies that have been published in the last week looking at mental health in relationship to COVID-19. So out of all these studies that I'm going to talk about here, and there are about 4 of them in totality, the general theme is that about 20% of those that had COVID-19 are at increased risk for some mental illness, specifically depression and anxiety. Now, the way I want to go with that is that there was an article that was published on the 9th, just about 4 days ago, in the British Journal of Lancet, which is Britain's and UK's equivalent to the New England Journal here in the States, which showed that there is an increased chance of not only depression and anxiety, but also dementia. Okay, and I'll get into that in just a minute, why the thought is that that information was there. But 69 million charts were reviewed, okay, including over 62,000 people with COVID. And it was found that 20% of people within 90 days of getting COVID were seen for depression or anxiety. Let me repeat that. 62,000 charts were reviewed of people that had COVID-19. And within 90 days, those people were seen again for a mental health diagnosis by a provider, primarily either depression or anxiety. Now, the belief of why this is because just surviving the trauma of COVID. A lot of times that will create certain issues where people being in intensive care units, what we call ICU psychosis, where you have a patient in the intensive care unit and sometimes they get days and nights mixed up. They just get confused. We call it ICU psychosis or sundowning. So that's one reason. The other reason is insomnia. When you've got COVID, you're up coughing, you're up sick, you're not getting good sleep. If you're in the hospital, you're being awakened by nurses and doctors and staff throughout, and you're not getting good sleep, hence leading to more mental pathology. Second is worsening of depression or anxiety. So a number of these people who already have a history of depression or anxiety can have an exacerbation or a flare-up of that. Next is, probably related to the awareness that people are dying from COVID. And am I going to die? I've not felt this bad ever, and so that's another reason. Another reason too why I thought that mental health would go up is because of the isolation and quarantine. Most people are social people, and we're used to being out and about, used to being around folks. And if you don't have that, you can certainly have issues with that. So that's one thing. Being less physically active is another reason. That's one thing. And also the inflammation that COVID creates, which affects the brain and the central nervous system, can lead to some neurologic changes, including depression or anxiety. Okay. There was also another study that was done by Oxford University along the lines of mental health, which said that people with pre-existing mental illness were 65% more likely to be diagnosed with COVID. Now, that was an interesting study. Some of the thoughts about that was that some of the people that have pre-existing mental health conditions may not have the best treated chronic conditions. In other words, some of those people may not be as diligent with taking their diabetes medicines or as diligent with taking their medicines for lung conditions. And so that's one of the thoughts behind the reason why that may be. As well as sometimes people with conditions like bipolar, schizophrenia, just sometimes by the mere nature of those conditions, may not be the most compliant folks. In other words, wearing the mask is off. They may not be adhering to social distancing and physical distancing just for a number of reasons, so that's one thing. Also, the reason there's thought behind, mental health illness and COVID is the financial strain that's being taken. So again, you may have people that are already living paycheck to paycheck, and then now they've got COVID and they've had to either stop working for a while, either the job let them go because they had COVID, or either the job just closed altogether because it just couldn't stand the financial hit. So those are factors. Also other things too, when things were shut down for a while, there was a lot of people at home, and there were a lot of couples and spouses that were home, and it was talking about the divorce rate going up since COVID, because people have been just around each other when they're not used to being around each other as much. So that can create some mental stress as well. So I wanted to kind of touch on the mental health side of things because again, I have an interest in that and the background in that, but two, it is real and it's something that's not really talked about as much. So when I did that research, I was, I'm surprised, but not surprised. I was surprised to see that I'd been thinking about it, and then they had just published a study on it. So, but number two, not surprised by the outcomes of the studies because of the stress and strain of what COVID is creating on folks.
Yeah, when you were talking about all of the stresses and the different factors that can contribute to the stress. It's obvious that it runs the gamut of just life in general, everything that you have to cope with and try to balance.
Right.
But, I think the two biggest factors that people have to deal with constantly on a daily basis, no matter how large or small, are the work factors and also the home life factors. And because sometimes you, especially now with there being more virtual remote work, you can't even find that balance of that separation between work and home. Right. It's really hard. And as you were talking, I decided to pull up something that I thought was interesting, Doc. And I know you can lend to what this article was stating, but or what this article stated, but Forbes magazine ran an article, Forbes.com, at the beginning of October, talking about the COVID stress factors that are related to work. So you mentioned the job loss worries. And yes, that's very real, especially in industries where furloughs and rifts are happening and people are just uncertain, especially if their jobs are based upon numbers, enrollment, productivity, clients, things like that. And as those things start to diminish or to reduce in size, then folks who are in those industries are wondering whether or not they will even have a position because the revenues simply aren't there anymore. Right. Again, the work from home challenges. I primarily right now work from home. Our requirement is that I won't call it a requirement, but they, encourage us to try to come into the office maybe once or twice a week. But for the most part, 99% of our work week is at home. And, when you're sitting here and you don't have offices or other spots on campus that you can walk to or whatever, the walls start to close in because you're seeing the same environment all day, every day. But aside from that, if you are someone who's trying to work remotely and then you have a family that you're taking care of, especially little ones, and you've got all of the situations with school districts and the hybrid learning and the this and the that, all of that compounds and really does cause the stress factors to just pretty much, be off the charts. And so, they noted those things. Also, just that entire feeling of being overwhelmed by it all. And I have to admit, I've even felt that way myself, that when you're dealing with all of the factors that I just mentioned, and then just the uncertainty of it all, and you're trying to stay busy so that you're not thinking about COVID so much, right. It all becomes overwhelming. And so, a couple of things that they mentioned that I think are, would be great for us to note today are, ways that you can actually begin to deal with these factors. And of course, I'm no counselor or whatever. You're definitely a doctor and you understand it all. But, one of the ways that they talked about was just pretty much acknowledging the problem, because I think that, in all the talks that we've had with mental health experts, that's usually the first step, is acknowledging that you have a problem or that there's an issue. And so, I think if you're a viewer who is in that particular type of a situation where you're feeling like, okay, I'm feeling something, I don't know what it is, then you have to just intentionally take a step back and take a deep breath and try to figure out whether or not it is related to your work, your home, a combination, and all of the other stressors, and then seek help, try to find out how you can, what resources are available for you to deal with it, because it's not going to go away anytime soon. And if you don't address the issue, then it will continue to compound and people will continue to just feel the frustrations and they'll bottleneck. And then after a while, you're talking to a walking time bomb and anything can happen. And so that was one thing that they said, acknowledge the problem. Do you see people coming into your office saying, hey, Doc, I just need something to take the edge off. I got something going on. What's going on?
Probably in the month of October, I would say, actually about 6 weeks, October to now, probably 40 people. Just by the nature of primary care and what we do act as psychiatrists as well. Because, in a lot of areas, particularly around here, there's a shortage of psychiatrists. So primary care docs by default have to do that and have to be well versed in diagnosing, recognizing, management, and understanding how to adjust management with depression and anxiety. But tremendous amount I can't even think of how many since March. I mean, but it's a tremendous amount.
Yeah.
I mean, I think in the last maybe 4 or 5 months, maybe, and I talked about this about 3 times ago, but there have been 8 million people that have applied for unemployment.
Right.
That have dropped below the poverty line in the last, 4 or 5 months. The poverty line number being less than 26,000 a year for a family of 4. So, I mean, when you're talking about already tight margins for some folks, and then now you're having to deal with the uncertainty of a job, the uncertainty of this, the uncertainty of that. I mean, it's tough, and I can imagine it's very tough. And again, as physicians, we try to be sensitive to that, try to understand what's going on. And again, as a physician that treats a lot of depression and anxiety, I try to be ever aware of that.
Another thing that they are encouraging people to do, basically, if they are employed and have health care plans or health insurance, and also other services that are provided by their employer, to actually seek those mental health benefits from the employer. Sometimes, those are the things that we often overlook, or we don't pay attention to them as much because we feel like we don't need them. But I know that they have, I think it's called EAS or something like that.
EAP, Assistance Program.
Yeah.
And I've had a number of people that I've referred to that are patients of mine that have that through their human resources at work.
Correct.
It's called EAP.
Yes. So you should do that as well. Seek those services that are provided, and you don't have to. You shouldn't have to worry about your quote unquote businesses getting out in the streets, because these types of things are confidential. Even the sessions that you have with anyone that you're referred to under EAP, those are they're counselors who have that confidentiality agreement between themselves and their patients. So you don't have to worry about.
Right. A couple things with that. It's confidentiality. Number 2, it's usually paid for and covered by your insurance.
Correct.
So that's usually an out-of-pocket cost that's not there. And number 3, it does make those providers that are EAP providers are screened to make sure that they're approved for that. So it's not just any and every person. It's people that have been screened and approved to be certified to be able to do that.
Right.
So I'm a big believer in EAP. For years and years, decades, have been referring patients to their EAP program and talking about it and that kind of thing. So very, very key, very important.
Yes. Another thing that they mentioned is just basically establishing those work-life boundaries and making sure that you as much as possible leave work at work. And even when you're home and you're basically just walking out of one room and from a computer that you've been using in your remote capacity, but just just intentionally telling yourself, I'm not answering any more emails. I'm turning off notifications. I'm done, so I'm done for the day, and just shutting it down. And so establishing those boundaries and making them firm and actually sticking to those boundaries. I know that, some colleagues of mine and I, we typically talk about walks that we take. I have one colleague, she takes a walk every single morning. And, I've tried to get into that habit as well, at least, twice or 3 times a week. And sometimes I find myself walking and I just need to walk and walk and walk. Right. And I ran and I ran and I ran. I'm forcing up. But you just have to do something.
It's taking care of a couple things. You're getting the physical activity in, you're getting the vitamin D in, you're burning up extra, adrenaline and extra stress hormones that are circulating in the bloodstream. You're burning those off. You're getting fresh air. And so all those things, are part of it. So certainly.
Absolutely. And then the last thing that they mentioned, and I don't think any employee should be afraid of asking for this. I mean, if they say no, well, okay, but at least you ask. But asking for flexibility, right. I don't know any employer who values their employees to the, in the way that they should, who would say no if someone says, hey, I just need some time, right. Maybe adjusting hours or even adjusting days that they work or whatever, especially during a time like now, because, again, that's a conversation that I tend to have with friends and colleagues all the time, that, sometimes employers forget that we're that their employees are people too. Their employees are human,
Right.
and they are going through things other than just trying to maintain the status quo at work. You know, they're balancing all these things that we just talked about. And so, you know, if somebody says, I need a break, it's not to be questioned. Just allow it. And, you know, and let it happen as much as possible. I mean, I know some things could be sometimes unreasonable, but at the same time, I think we're in COVID land right now, and this is something that we have never ever experienced before in our lives, at least some of us, and most of us, unless you're, you know, of age or, you know, up in age. But a pandemic type situation, I don't know that a lot of us have even unpacked the idea of being inside of a pandemic and having to go every single place with a mask, and to, you know, sit in restaurants and, you know, go to grocery stores, and like you said, not being able to hug our loved ones and attend functions and all of the social aspects. So the flexibility is definitely needed, and don't be afraid to ask. If you have the time built up on your job, yes, you deserve a break. You know, put in for that break. And or if you can come up with something creative to ask for something that's a little flexible for a week or two or whatever, then do that. But, you know, it's about self-care. And I have a great girlfriend right now. She has started a 60-day challenge with some friends, and she's challenging everybody to just take care of themselves, even if it's for no more than 15 minutes a day, to just do something that has nothing to do with work. That's not a focus on COVID per se, as in sitting around watching the news or whatever, but just doing something that takes your mind to a different place so that you can, you know, just kind of exhale for a minute. So, yeah.
And that's key. That's key to the mental health. But I wanted, you know, to make sure that we emphasize that, because again, we have not, and we've talked about the mental health side before, but again, that's foremost on my mind here as of late, because I have been seeing more people coming in with those symptoms and that kind of thing here lately. And it's been there all before, but I think as we get closer to the winter, as we get close to the fact that, and the seasons play a part in this too. I mean, we're having less daylight. And so a lot of people that have what's called seasonal affective. So a lot of times we know that depression and anxiety will go up during the colder months for a number of reasons. Number one, we're not outside quite as much. It's not as hot as it is. A lot of outdoor activities have been curtailed. It's getting darker a little earlier. So all those things play a part in it too. And so again, I certainly understand that with, you know, seeing patients now for over 25 years. And so understand that that is the nature of what it is, even before COVID, but more so now that we're talking about COVID.
Yeah. And Doc, we're getting into the holidays now, and that always seems to, you know, be, the holidays are triggers. They are triggers. And, you know, and then we've got some of this, you know, rainy weather and things going on. I mean, there's just so much right now, you know?
So all that plays a big part in it. And again, that's part of the reason why in medicine and science, we felt like the numbers were going to go up right around the end of October, early November. So the fact that it's going up is not really a surprise, because I think we've talked about that a number of times before. But the fact that the rate of rise, the rapidness of this rise, the fact that, you know, South Carolina has a, you know, over 14% positivity rate. That's amazing. And again, I have to keep prefacing it by saying we're still under testing.
That's right.
And so, you know, when you look at those numbers, knowing that there needs to be more testing, you know that it's more prevalent than the numbers are really telling us. You know, even with Coastal, I mean, our game this weekend got canceled because the team we were playing, Troy, had an outbreak of COVID on their team.
Wow.
So our game got canceled for tomorrow. So again, we're seeing that along the lines of colleges. The University of Connecticut has about 540 students in quarantine right now. So 540 at the University of Connecticut, not just to sort, you know, to pick them out, because, you know, universities are having it across, but that's a large number of people. And so, so that's a concerning thing there.
Now, Dr. Mack, not to cut you off,
Mhm.
but are they quarantining on campus, or are they sending those students home?
Well,
You know?
when the quarantine stuff first came out, it was to send them home. That was the thought.
Okay.
But then the CDC and physicians started revising that to saying, no, if these colleges can find places to where they can stay on campus or get the people out of the roommates out of the room and have them by themselves, to try to isolate them. Because if you send them home, you got to send them home on a bus, a plane. You're sending them home to parents that are likely elderly who have issues. So now the thought is to try to keep them on campus if you can. Now, some colleges just can't accommodate that, and so they are just sending them home. But the thought is that if you could keep them on campus, isolated in some shape, form, or fashion, that probably would be the better public health thing.
Mm-hmm.
But again, it's up to each individual campus as to how they handle it. You know, I've got some friends of mine who are sports medicine docs at other universities. We'll say, for example, HBCUs, small universities, and they were calling me, asking me about what I was doing at Coastal, what we were doing at Coastal, and to talk up to their universities about whether they should be playing sports. And so my take on it was this: if you don't have access to getting frequent testing, you probably shouldn't be playing.
Mm-hmm.
If you don't have a place to isolate or quarantine these positive people, you probably should not be playing.
Mm-hmm.
And if you don't have a physician who has, valued input to the university, you probably should not be playing. Hence, a lot of smaller schools, HBCUs, and smaller PWIs that opted not to play because they didn't have those things in place.
Mm-hmm.
At Coastal, we're fortunate that we did have the majority of those things in place, and we were testing early. We test once a week right now. Everybody, I've gotten like 5 tests in the last 6 weeks. Right. So we do have those availabilities to do that, but not all universities and colleges do, and they should not be playing if they don't.
Well, I know that there are also some colleges, universities that are, they're getting ready to break actually for the semester.
Right.
There's an HBCU or 2 that I know of, and I believe that their students will be finished sometime next week. Once they go home for Thanksgiving, they're not coming back for the rest of the semester. So,
well, my daughter's at Hampton. My oldest is at Hampton.
What are they doing?
They're not going back on campus at all this entire academic year.
Mm-hmm.
They announced in July that they were not going back for the fall, and they announced about 2 weeks ago that they were not going back for the spring.
Okay.
So when she's taking her finals, I think next week, and she'll be done for the semester.
Mm-hmm.
They're not going to be live on campus until August of 2021.
Well, I mean,
mm-hmm.
Yeah. Well, and so now we're definitely not rounding the curve because if anything, we've kind of run up on the curve with COVID-19. And I know that there's some talk. There was a news break today, a conference about, and there was some mention of vaccine.
Right.
Any developments with that?
Yeah, so that was the next thing. Girl, you reading my mind.
Hey, we've been here for so long.
So there's several different companies that are in phase trials to try to get it out. The one that's been the leader right now is Pfizer. And Pfizer's not under the governmental program with that. They're doing their own thing. And right now, their vaccines are showing about 90% effectiveness. Now, again, that's preliminary. That's good news. 90% effectiveness, but they still got some more research and some more work that they've got to do to make sure that those numbers are sustained there. Mm-hmm. But that is good news. The only concern about the vaccines, though, is that even though they may come out with a vaccine, you got to get millions of people to take the vaccine.
Take it. That's right.
And so that's one thing that will become an issue, possibly become an issue, as are people going to take it? And so that for various reasons, there are going to be a lot of people that opt not to take it.
Mm-hmm.
you can't rely on herd immunity, which it appears. I mean, I don't really want to talk about politics, but it appeared that the last administration, or the current administration, excuse me,
Mm-hmm.
was trying to rely on herd immunity, which means so many people will get it, and people will, get antibodies built up themselves because they'll do it. But you can't really do herd immunity, or it's not smart to do herd immunity with a novel virus, because as we see, a lot of people will die.
Right.
So that's in a physician's mind who understands science and research, that's not an option.
Mm-hmm.
That would not be an option.
Mm-hmm.
Preferably, there would be a vaccine that would be a safe, effective, and proven vaccine that enough people will take to help out. But again, people are going to have different reasons why they don't get vaccines. I mean, heck, there's a lot of people that don't get the flu and pneumonia vaccine.
That's
so
true.
let alone you're talking about a vaccine that has been produced in 7 months.
Mm-hmm.
So again, there will be some major hurdles to get over to try to get people to get the vaccine. Some of my patients and I've had over 200 patients now with COVID. So some of them, who've got COVID will say, definitely I'll get a vaccine. And then some of them have been like, no, I'm not going to get it. Typically, the people that were the sicker people are the ones that are saying, yes, I will get this vaccine. If there's some chance that I could get COVID again, which is still kind of debatable,
Right.
that they would take the vaccine. The people that have milder cases, most of them that I'm asking are saying, no, I'm not going to take it. So again, it just depends on the person, the level of sickness that they had, age, other chronic conditions that they may or may not have, all play a part in that.
Mm-hmm.
Mm-hmm.
Well, I tell you, Doc, I know that we have to talk about the numbers, and we have to be as realistic as possible about the facts. Facts are real, and that's all there is to it. And so you're always coming from that place, as far as a resource and just your expertise. And I know that our viewers appreciate that. I know I appreciate it. And also, you always say, you don't want to tell a story of doom and gloom all the time. Good news. Anything you want to share as far as?
The good news is there, the vaccine, and it does look like it's going to come to pass. Mm-hmm. So that's good news. The good news is that, President-elect Biden has developed a task force that will be in place, with that's going to be stocked with physicians, researchers, scientists, who understand this and understand the significance of COVID-19 and what it could possibly be, to get together to talk more seriously about things to do to help. Other things is that they understand these numbers from the University of Washington. I mean, those are stats that they've been given for a while now. And so whenever you've got people in the room that are talking about those things, and from a health perspective, it makes a difference. Whenever healthcare becomes a political item, people die.
Right.
And so because a lot of times people just don't take it seriously, because the people that are making the decisions have the best of healthcare. Mm-hmm. They have good healthcare. Their families have good healthcare. So when you don't have to worry about healthcare, it becomes less important. Mm-hmm. It appears to me that that's what it is anyway.
Yeah, it does. It really does. I mean, they can't relate to it because they're not feeling it. They're not in the struggle,
Right.
And you mentioned the new team that's being put together by President-elect Biden. I was following an article on that as well. And the first of all, the team is extremely diverse. Yeah. Definitely medical experts. I don't know that there were too many people who were not doctors on the team, and coming from all facets to bring the education to it and the scientific facts to it. And and I'm sure that that's something that was attempted by folks who were trying to disseminate information through the current administration, however, the limbo administration, wherever we are. But it does appear that, the group is extremely cohesive and will give us, what we need. And that is the hope and the prayer. The other part of it is, I think, you mentioned Pfizer a little bit earlier. It was stated in an article that Pfizer is also working hard to make sure that this vaccine will either cost nothing or will be extremely, extremely cost effective for individuals. And they're trying to get it to the point where it's like the flu shot or, any of the other shots that may be free or very low cost. So hopefully that will come to fruition as well.
Yeah, it appears that way. Like I said, the numbers look good so far. Again, it's preliminary, but that is really some of the best news. They're doing this independent of the government. And as a matter of fact, they're really doing it independent of Pfizer. So they've got an advisory panel that's actually non-Pfizer connected, that's actually evaluating the data, the research, and that kind of thing. So it looks promising, and that kind of thing, because again, it's just so much of an increase here, especially lately. You got, some states that are going back to the point of where they're canceling elective procedures. Some hospitals you can't, in some states, you can't get elective things like, colonoscopies, or orthopedic type surgeries because they just don't have the availability. There's an article that I wrote in the Whittemore newsletter that just came out. And for those that, really want to understand the financial cost of what COVID has caused the United States, please get a copy of that and read it. I took some time going through that to research it and to get the information. I didn't realize Brother Edward was going to put me on the cover.
He did. Yes, you're on the cover for November.
But anyway, we that article really that I wrote, I really took some time to research it, and really over about a 4 to 6 week time period. And it really does highlight the financial cost of what is cost the United States as far as COVID goes. And I would encourage you to read it. The numbers are staggering on it. All the facts have been checked, double checked, researched, and it really kind of tells the cost of COVID on the United States. And that's just what it is right now. I mean, that's not to say, as it goes further and further along on the cost of it, from the cost of increased PPE to the cost that it's been for having to cancel some of these surgeries, the cost of having to pay overtime for physicians and other hospital employees, the cost that it was to hire temporary physicians because some of the physicians got COVID or they were just working too many hours and they had to be replaced. So these hospitals and hospital systems had to go to temporary physicians, what we call locum tenens, to come in and work, for a temporary time to relieve physicians. All that's in that article, and it gives the actual numbers, facts, and figures and statistics on that.
Well, what I'm going to do is to post that article on wcmagazine.net because it is a very important article, and typically we will post at least the cover of the issue, and the magazine is available by subscription. There you can get an e-copy of it for $35 a year, actually $50 a year, and then there's also a print edition that's available, but I will post that article so that you can go to WC Magazine and just click on Dr. Mac's cover and it will take you to the article. I'll do that this evening, and you can read that article. But excellent information, excellent research. It's shareable, so you can make sure to let everyone else know about it. But yeah, Dr. Mac, I mean, you have you've totally brought it full circle and created what we need in terms of the information, just the backstory, everything that we need. And people just need to really be cognizant of the fact that You definitely don't have time to make it up. You don't have time to play political games with it. This is just all about saving lives and making sure that people understand that this is not a game. It really is not a game. And it's, I think a lot of people are just really sick and tired of the games that people are playing with COVID. And
Right.
so,
Right.
I'll make sure that's posted so that everyone can read it.
Gotcha. I do want to respond to a question from my friend Van Goss.
Mm-hmm.
She was asking about high school sports, basketball during COVID. Van, that's a good question. Here's how I answer that. We do know that there is more of a risk with basketball than football. We understand that because you're close together, you're playing defense, you're playing against other people. As far as the colleges and universities go, let me start by saying this way. We're testing our basketball players 3 times a week. We will be testing 3 times a week. The unfortunate thing about it is that these kids in high school are not being tested like that.
Mm-hmm.
A lot of times, again, you're talking about 50 to 60% of people that have COVID that are not symptomatic. They're asymptomatic.
Right.
So
Mm-hmm.
it is a concern. It is a major concern. It's a major concern for any close contact sport, whether it be basketball, whether it be wrestling, whether it be any close sport that you're close together. There is some concern, and there's some sports that will be at a higher risk than others, and some that'll be at a lower risk, of course. But basketball is one of those that's closer to the higher risk.
Mm-hmm.
And so again, that's a very real situation. That's something that I thought I was going to have to deal with because my daughter was a basketball player, but she's opted to go full-time track. So I've got less of an issue with that. But no, it's an issue, Van. And from the fans, how many fans are you going to have in there? People are checking temperatures and all that stuff. But again, over 60% of people are asymptomatic. They may not have a fever at all. So, again, how do you decide how many people are coming in the gym?
Mm-hmm.
How do you decide, how to seat them, how to space them, so it's, these kids are traveling on buses to games together.
Mm-hmm.
So again, high schools don't have the wherewithal to test like colleges do. And so that can potentially be an issue. I mean, as we see, a number of the high schools actually had to cancel games because of football games because of COVID and people testing positive. Well, I mean, basketball, it's going to be even closer contact without helmets, so again, it's going to be an issue.
Mm-hmm.
It's going to be an issue.
Yeah. Brother Edward is obviously watching the broadcast, and he made some comments, says, please be careful of all vaccines. What do you have to say about that, Doc?
Well, as a physician, I have to advocate for vaccines, okay? Because we do know vaccines save lives. Now, I know there's a lot of controversy about trust in the government or trust in pharmaceutical industries, but we do know that if a person gets COVID and they get pneumonia, they can die.
Mm-hmm.
We do know if a person gets COVID and gets the flu, they can die. We do know that the stress that COVID can cause can flare up shingles. So again, shingles is just basically a reactivation of chickenpox. You get chickenpox as a child, it never goes away, it goes to sleep. And so stressful situations can reactivate the virus, which can come back as shingles. So again, there's a lot of controversy about vaccines in general for different reasons. But again, as a physician, I have to advocate for vaccines. That's just, what I'm trained to do, because I know there are people that will die, who likely would not have died if they got the vaccine.
Mm-hmm.
I can't say all people, but
right.
there's going to be a substantial number that probably could live if they had gotten it.
Exactly. There's a question on the thread from Tamika Gore. Thank you for watching out of Charlotte, North Carolina. Dr. McIver, can someone is passing in passing mentioned there's an option for a quad flu shot that covers 4 strains. Is that accurate? And if so, where can we get it?
Well, it depends on, well, let me back up and say it this way. Most vaccines now are being given through the pharmacies. Okay. Once upon a time, physicians' offices were the primary source of getting vaccines. But the pharmaceutical companies have gotten into the business of vaccines now, and primarily because it's a marketing tool to get you into the store. It's estimated that a person who goes to get a vaccine is probably going to spend anywhere between $10 to $25 while they're waiting to get the vaccine. So it's a marketing ploy. Again, a lot of that depends on the insurance as well. So you may want to check with your insurance to see what kind of vaccines are covered, or you can go to your pharmacy to see, and give them your insurance card to see if they can run that. So again, that's kind of how it is. It's kind of insurance specific on that. Mm-hmm.
All right. Okay. Well, if you have any other questions or comments, please post them. We're going to be on for just a few more minutes. There was a couple of things that I wanted to be sure to bring to our community's attention. And so again, we'll be on for just a few more minutes, and Dr. Mack will certainly answer any questions. If they're not COVID related, that's fine. Just like Tamika just asked a question about flu shots. I'm sure if you have any questions, especially as we fastly approach or we're in that season now, he will definitely be able to give you some information. But I'm going to pull up just a couple of things that are notable. I would consider this notable information and something that we definitely want to celebrate at this time. We have a number of firsts that have happened. And of course, there's some things that are, have been the point of a lot of contention in the past week. But, we cannot help but, bring some attention to the, major things that have happened in our nation. First of all, President-elect Joe Biden and VP-elect Kamala Harris. President Biden will be the 46th president of the United States. Election 2020 happened on November 3rd, and it's still happening. Isn't that something? And I just read a breaking news report that Georgia turned blue. So he will indeed win Georgia. And I tell you, this is going to be quite a novel and quite a movie when it's all said and done. But, there were some, of course, contenders and people in certain races that, were not as successful in this particular election. But it doesn't mean that they have to withdraw from the political scene at all. It just means that, there's a lot of work that needs to be done. But we'd like to thank, all of the winners, congratulate all of the winners. And hopefully everyone can come together under the spirit of unity and healing and move forward to make sure that we do all that we need to do to not only, create the kind of America that we know and love, but also, or maybe recreate it, but also to make sure that, we're definitely moving forward in a positive way to rid ourselves of this COVID epidemic once and for all. And I think that, some of the points that we made today are pointing to that. They are already at work as much as possible and as much as allowed. And they're doing whatever they can to start making appointments. He's already appointed his chief of staff, and, he's doing the presidential thing right now. So it's really time for everyone to move on, and let's get down to the business of America. So we definitely want to congratulate them as well. And then, of course, some other notable firsts. Robert L. Woodbury was elected and has been sworn in as the new mayor for the city of Mullins. This young man has served on their city council and is now their new mayor, and is only 31 years old. He's only 31 years old, Doc. All right. You're muted. I think you're muted.
That's impressive.
It's very impressive. It's very impressive. A rising star on the political scene. You know, he had a very strong message in an article that was recently published, basically saying it's time to get down to business and, you know, to make sure that he's doing everything to support the people of Mullins and to make sure that the city of Mullins is on a great and positive track to becoming an even greater city and something that's viable for its residents. So we wish him, you know, all the luck and congratulations and blessings and everything to come. But Robert L. Woodbury is the first African-American mayor for the city of Mullins, 31 years old. I just think that that's just absolutely awesome. I wish I had a clap track. I'd clap for him. Definitely. And then we have another first in the city of Florence. We actually can also congratulate Teresa Myers Irvin. She is the first African-American mayor for the city of Florence. I mean, absolutely incredible. You know, I'm telling you, this has really been an amazing time of firsts. You have Kamala Harris being a part of the Biden-Harris team, of course, a ticket, being elected our first female vice president and vice president of color. And I say of color because she's Jamaican and she's Indian. So she represents that entire spectrum. You know, and then, you know, the first with Mullins, the first now with the city of Florence. And she is the first woman to Miss Irvin is the first woman and the first African-American to serve in this position. And it's incredible. And it's also an exciting time. And it also lets us know that the work that needs to be done in politics, it doesn't just start at the moment when we say, okay, you know what, I'm going to jump in the ring because I've never really, you know, I want change. It can start there, but with these two people, it started with a progressive movement through the political channels to really understand how government works and to understand how politics works, and to make sure that they were ready to step into these shoes to make changes in these cities. Both of them served on city councils in their respective cities. And so, you know, they've been there, done that, veterans at such a young age. And now it's time for them to take the highest leadership roles in their areas to do some even bigger things. And I think that with the election of Brother Woodbury, it goes to show you that as well. I know that you can be too young because there's a certain age you have to be in order to run, but we need to start cultivating young leadership now, especially for upcoming elections and you know, other races that are to follow. I mean, you know, pretty soon we'll be looking at a 2024 race, and you know, there's so many things that need to be done. So it's just great to see these two people in our PD area elected to their posts as first. And we definitely applaud them here at the network. So I just want to, you know, kind of send up some congratulations for them. And, you know, hopefully we can have them on the show in the, you know, maybe the next couple of weeks or whatever. I know they're probably trying to get their bearings and unpack everything, but I think it's a great thing, Dr. Mac.
Yes, definitely.
It really is a great thing. Yeah. And so there's a couple of other things that I also want to bring to everyone's attention. You know, we definitely want to let everybody know when there are great webinars and, you know, conferences or sessions that can help you as business owners and entrepreneurs to actually you know, get the education and the professional development you need in order to move forward. So what I want to show you as well, there is a session that is scheduled for November the 14th. It is free, and it is hosted by Dr. Grace Stevens and the Global Christian Professional Women's Association. It's a virtual event on leadership and entrepreneurship. And this particular powerhouse session is what they're calling it, with Ann Baylor, who is actually the owner of Aunt Annie's Pretzels, I believe. And so she's going to talk about best practices to take your big idea to the next level. Again, this is a free session, limited space. You can register, and the link is below. So I would copy that link and put it into your browser so that you can click on it and actually register for this session. It's November the 14th, which is tomorrow, from 10 a.m. to 12 p.m. And if you need some $1 million best business practices, if you're trying to get into a leadership or entrepreneurship role, then you'll want to tune in to this particular session. Additionally, and I know this is early, but it's, time to plan. There's a webinar that is being hosted by the Small Business Development Corporation out of the Orangeburg area, but this is open to anyone who's interested. But there's a webinar on Thursday, December the 3rd at 3 p.m. There's a lot of people who have talked about starting their own food truck businesses. And I know that one of the most widely known food trucks here in Conway is the Jamaican food truck that usually is parked outside of the C3 coffee shop. But if you are interested in starting your own food truck business, then you'll want to tune into this free webinar as well. You'll learn about the mobile food business, the regulations, and the resources you need to start up your business and how to market your truck. And I think that's the most important part that some business owners tend to forget, is that you have to market your business and make sure that you are promoting it the right way and advertising what you have to offer. And that's the only way that you can build up your clientele. You got to create the awareness. Yeah. So that was some information that I definitely wanted to share. And then also Monday night on the Whittemore Community Magazine Live at 7 p.m. Brother Edward is tuning in now. And of course, he is the host of the show. He will have a special topic discussion with Sam Rue and Lee Moultrie. And they're going to discuss the future of the Affordable Care Act, which of course is before the Supreme Court right now. So everyone will want to tune in on Monday evening at 7 p.m. on the Facebook or on WC Live right here on Facebook. And you can be a part of that discussion. So just a few things I want to mention, Doc. Do you have anything else before we part for the night?
No, I mean, I think that webinar on the food truck is great. My buddy Kamal, with the Jamaican food truck. I told him he's already made me an honorary Jamaican. So so I told him, I think the only thing I got to do is just go there and kiss the soil.
That's it, right? That's it.
And then I'll be an honorary Jamaican.
And I know, what do you have a favorite dish?
Well, I haven't had a bad thing on there. My two favorites though are of course the the jerk chicken and the curry chicken. And he does a great job, and he's in high demand. So he's not just at C3 now. He's kind of he has to put a schedule out on when he's going to be where.
See, that's a good problem to have.
Yeah, he's in demand, private parties and that kind of thing, and but they do a really good job.
It's good food. I tell you,
he's from Jamaica, so he's not somebody trying to play a Jamaican.
Correct.
And from what I understand, he actually took cooking in school, so he actually did that and cooking in business and kind of to parlay it into a business. So he's done a very good job. Yeah, the oxtails are good. I'm not really a big oxtail eater, but he let me sample some oxtail, so that's good. And I'm not really a big goat eater, but he let me sample some of that too.
I haven't done the bleep bleep.
It was pretty good. I mean, it was pretty good. It was pretty good. But he's got everything there that you can think of. I mean, it's authentic. I mean, like I said, he's not trying to play a Jamaican.
No, not at all. Not at all.
He knows the deal.
And you can get caught up in those dishes. I mean, I have gotten caught up in that curry with that cocoa bread a couple of times.
You got it all. Cocoa bread, festivals, beef patties.
All that.
He got it all. Yeah, so they do a good job there. He's done very well, and I try to support him, and I'm by there at least once or twice a week. So
it's good, authentic food.
Oh yeah.
A lot of love and a lot of soul. So
it's good.
Absolutely. So, if you don't have anything else, I'm good. And I think that, of course, as always, you've given us great information, and we will continue to also bring community news, because just like someone said, we really need to make sure that everyone understands what's going on as far as the community calendar is concerned. So when you have, events that are happening, or you want to talk a little bit about a special cause that you're supporting or something that you really want the community to know about, just let me know. I actually put a little message out today on the network and said, hey, hit me up if you want to make a cameo appearance. I'm down for that. just trying to share the platform and spread the word. So, go ahead.
Van asked, where is he located? He's right on 501, right where the old Shoney's used to be. Right beside Applebee's in Conway. He has a food truck that's parked there most days. There some days when he's not there, because he's actually doing private stuff and that kind of thing. But
I think he has a Facebook page.
Yeah, he does have a Facebook page as well.
Yeah, he has a Facebook page, so you might want to look it up. And they used to have the restaurant in downtown Conway, and it's not there anymore. But and I know he was instrumental in that establishment being open downtown.
I think it was his uncle, if I'm not mistaken.
Yeah, someone. Yeah. And so, but I mean, that food truck. I mean, really, he's able to stretch his boundaries with that because he can travel. Look we'll bring you out there.
He let me look inside that truck. It's decked out. I mean, he really put some thought into that, and and again. You know, it's that old adage. Sometimes you got to spend money to make money. And
that's the truth. That's
so he's so he's done very well with that, and the food is very good. I mean, it's very good. You know, final words for me is that I want people to just stay vigilant when it comes down to COVID. I know it's easy to get what we call COVID weary, where you're just tired of thinking about it, tired of talking about it. You know, as a physician, it's something that I deal with every day. So I find myself sometimes getting, a little weary about it. And I know, April, you and I have talked about it several times about this, but it's still a message that needs to be put out. People need to be vigilant. Even more so now, we're seeing higher numbers than we've ever seen on hospitalizations. We're seeing skyrocketing numbers, like I said earlier, almost 1,900 deaths on Wednesday, which is the equivalent of 15 737s crashing. I mean, these numbers are real. These numbers are significant, and even if it may not be anybody, it is somebody that's dying. And so, just be careful, because if it can happen to one person, it can happen to anybody.
That's right. That is right.
So, not all these people are really, really, really sick either that are dying. Most of them have multiple medical problems, but don't be mistaken to think all these people are sickly people, because that's not the case. I just read instances about, people who really had little to no medical problems that are passing away. So, again, we're seeing that as well. So just be careful, protect yourselves, protect your families. I know I had a couple conversations with patients today talking about Thanksgiving, and one person, said they were still going to have their usual family get together with Thanksgiving. And then some people said that they're not. One person said they was not going to have it. So again, you have to judge that, some people have family members that are still out and hanging out and doing their things. And you have to be careful. If they're coming to your house, they can bring whatever they got with them. That's right. I'm not saying don't have them, but I'm saying we're seeing an uptick in numbers. I think the Washington Post just ran an article on that a lot of the links to these higher numbers are people congregating together now. And so again, we're seeing that in churches. We're seeing that.
Yeah, I've seen a little bit more traffic in church parking lots than I care to. Definitely.
You got to be careful, because again, like just in a lot of churches, just like in our church, April, it has an elderly population. Yes. And when those church doors are open, those people are going to show up.
That's right.
And so again, a lot of those people have multiple medical problems, lots of medications, lots of pre-existing issues, high risk for pneumonia, high risk for the flu, high risk for things that can create major problems if COVID is contracted.
Absolutely. All right. Well, Doc, we will bid everyone farewell right now, and we hope that you all remain safe, as Doc is imploring you to, and just stay vigilant, just like he said. And of course, going into the weekend, go ahead and get your Thanksgiving vittles together if you're going to do the Thanksgiving thing, and just be safe. Be safe. Don't eat too much pie.
Yes.
Potato pie. And
yes,
potato pie.
That's my thing.
Yes. Someone tried to make me feel good the other day, and they said, "Well, it's a root vegetable." I think they said a root vegetable. Oh, okay. Whatever is good. That's all I know. But anyway, but yeah, everyone just stay safe. And, you know, we hope to, yeah, we'll be back next Thursday. I think we said we were going to, maybe Thanksgiving week. We may not be here.
Yeah, probably won't do it. Yeah.
Probably won't be here for Thanksgiving week, and that'll, you know, it'd be a well-deserved break. But you know, we'll, you know, I'm sure if there's anything major we need to give to you, we'll figure out something before Thanksgiving. But
right.
other than that, thank you all for supporting us, and we hope that you have a wonderful weekend. And Doc, I'll be talking to you real soon.
Okay, take care. We'll talk. Thank you all for watching.
Okay.
Bye.